and welcome to the webinar. This is Dr. Andrew Jones. Hi, I'm just wanting to make sure all of you guys are able to hear me. We're just starting with the new, it seems to sort of go back and forth with different webinar stuff, and we're just going through a new webinar platform. So we're just wanting to make sure it all works. So if it does work, that would be great. If you guys want to give me, I'm not sure if you can say a thumbs up, or if one of you are listening and you actually hear me, if you could type in there and say, I can hear you, that would be awesome. Anyway, great. First, well, thanks for being here. I'm Dr. Jones. Welcome to today's Natural Animal Care Web Clinic on veterinary secrets, how conventional veterinary medicine may be harming your dogs or cats and what you can do about it. Oh, and someone says, I can hear you. So this is Celeste. Hi. Oh, I'm awesome. I'm glad you guys can hear me. Yay. Awesome. What I'm going to do is give everybody a few more minutes to join. We had well over 500 people register, and my brother said the maximum it holds is 500. But we know not everyone who signs up is going to show up. But I do want to give everybody a chance to get on before we get going with today's presentation. I hope you guys are all doing well. Your pets are doing well. Your dogs and cats, they're all pretty healthy. And I'm pretty happy, pretty pumped. I now have a new-ish dog. It used to be one of my neighbors who since left. So her name is Tula, and you're going to see her in a few slides shortly. You're going to see a picture of her. So first, thanks for being here tonight. For those of you who don't know me, I'm Dr. Jones. Welcome to today's presentation. We're covering a whole bunch of stuff today, so I'm going to get right on into it. And thanks you guys for typing in to say that you can hear me loud and clear. That's awesome. First of all, shut off all your distractions, anything that's going to take you away from the presentation. Definitely, I find the more present you are, the more you're going to get out of it. A little bit about me for those of you who don't know me. I was born and raised on a farm. I always wanting to be a veterinarian, and definitely as a kid, I spent countless hours with our animals. That's me pictured in those styling clothes with our cat Beauty and that pretty fancy looking haircut. I graduated from the University of Saskatchewan in 1992 with my Doctor of Veterinary Medicine, and I practiced for 17 years owning the Nelson Animal Hospital here in Nelson, BC. I wrote my first natural care digital book, Dr. Jones's Book of Home Remedies for Dogs and Cats, in April 2004. Since that time, I've published hundreds of articles, reports, videos, put out 2 home study courses, and we even held a live seminar. I was featured on ABC's news show 2020. So after the presentation, you can go ahead and Google that 2020 and you'll see me speaking on 2020. And a few years ago, I released my first sort of quote unquote real or hardcover book called Veterinary Secrets on Amazon in 2014. I'm pretty happy to see it go on to become a #1 bestseller. And if you're one of the people that purchase a copy, thank you. I've always had animals. Here are some of our recent pets. Unfortunately, within the sort of the last year and a half, they all died. They were all senior animals. So there's our dog Jesse and dogs Jesse and Lewis, who are over there on the left. They're hanging out at one of their local lakes. Our guinea pig Oreo, who was she was over 10. They just giving my daughter a kiss. Then our cat Gussie in the top sort of upper right hand corner. She was almost 20, I think 21. And our cat Cleo, who was I think almost 17. Everybody was senior guys, and they live pretty long, fulfilled lives. And it's just hard to have them all sort of die within that period of time. And here's my current new animal to our household. Her name is Tula. She's a curious mix. She's a standard poodle, was the dad, crossed with a corgi, shih tzu, border collie. Go figure. It's hard to tell what she is. I call her a Kootenai special. But there she is, mountain biking with me on the left. And she's full speed. You see how fast she is. She's got that dreadlocks in the center, so she really fits into my little community. And there she is on the right after she just got groomed yesterday with my son as well, with her nice little bandana, looking all pretty for the presentation. So why consider natural animal care? Well, clearly, natural healing, it's an attempt to help our dogs and cats by addressing the underlying cause of a health problem. Obviously, its goal is to help our pets help themselves by doing things such as improving their immune systems and eliminating whatever is causing the symptoms in the first place. Ultimately, we want our dogs and cats to have strong immune systems so they're able to obviously fight off an illness before it takes hold. And then you don't need to be relying on things such as conventional medication that may in some cases do more harm than good. A little bit about the health of our dogs and cats today. Really, modern medicine, it should be giving ourselves, our pets, longer, healthier lives. But it really seems in many cases that's the opposite. We've got this, in my opinion, pretty unhealthy population of dogs and cats. And in some cases, with our animals getting serious diseases at younger and younger ages. A couple of older guys, older dog, older cat, which is what we want. That's all, obviously our goal. And it's not just about our pets living longer. It's about them being healthier while they're alive, quality of life along with quantity of life. A little bit of information about cancer. And this comes from the National Canine Cancer Foundation, saying that cancer affects 1 out of every 3 dogs. And of those, over 50% of them are going to die of cancer. Golden Retrievers have the highest incidence of cancer among all dog breeds. There's 2 types of cancer, hemangiosarcoma and lymphosarcoma, the most commonly diagnosed types. The breed's lifespan is now dropped to now 10.5 years. And of that, 50% of all Goldens will die of cancer. It's really some pretty crazy cancer rates. On top of that, we've got our pet having these ultimately really very short lifespans. My dog, Lewis, he was getting close to 15, but that's not very old. 15. Jesse, he was closer to 17, but still that's not old. They're relatively short compared to our average lifespan of 80. So they have these short lifespans, high cancer rates, and that really begs the question, why? Why is this happening? A little bit about when to treat your pet at home, when to seek veterinary care, and that's a big part of what you're learning about tonight. When is it appropriate to do a home remedy? When should you be going to get conventional veterinary care? And that's one of the questions I get asked over and over again. Can I treat my pet at home, or should I take him to the vet? So you need to be comfortable assessing your dog and cat, knowing what is normal, such as normal temperature, pulse, respiration. Are they dehydrated or not? What is normal gum color? A healthy light pink color. A big point of that and learning to do that is learning how to examine your pet weekly. Just learning how to examine your dog or cat at home. I've got first information on my YouTube channel, so you can just search up Dr. Andrew Jones YouTube and I'll come up, or Veterinary Secrets YouTube. Also on our blog, veterinarysecrets.com/blog. And in both places, you're going to find specifics of how to properly examine your dog and cat. Here are some serious clinical signs to be aware of. Your pet is very lethargic, weak and tired. Ongoing and frequent, things such as vomiting and diarrhea. Dehydration. Obviously an obvious pain or distress. Straining to urinate, especially these cats. If that's going on, you need to go see your veterinarian. When your pet goes for any extended period of time where they're not eating and drinking, where they're severely anemic, so they've got very pale gums. Seizures, if they're jaundice, yellowing of the eyes, mouth. If you see that, you should see your veterinarian first. Bloating, so you got the serious distended belly. Some of the neurologic disorders may show up as difficulty walking, loss of balance. If that's the case, your dog or cat should first get a veterinary exam. More serious emergencies where there's bleeding, fractures, breathing distress, increased rate of breathing. Clearly, that requires an immediate veterinary exam. If you're unsure of a diagnosis, just please go see a veterinarian. But the difference here is I'm expecting you to be advocating for your dog or cat, not just being a passive client, accepting whatever your vet may be advising. And ask a lot of questions, such as what is the likely diagnosis? If you do those suggested tests, will it change the treatment? Is there a safer medication? Can we wait before treating or performing diagnostic tests? And are there any alternate options? And if your pet is going on a medication, ask, what are the drug side effects? Does it interact with any of the medication that they're on or may be on? Now I want to get into some of the healing modalities. And sorry, you guys, I may seem like I might be going a little bit fast, but we've got a whole bunch of stuff that we're trying to cover tonight. The other thing I see, some of you guys are saying my voice is a little bit chopped up. It's hard to hear it. The other thing is all of this is getting recorded and you're going to get a copy of it after to refer back to. So let's get into the first healing modality, healing with herbs. Herbs as alternatives to conventional medication. They are safe, gentle medicines with a much greater margin of error and fewer side effects than most conventional medications. They're actually safer because the ingredients of the whole plant work together. And because as the whole plant is often more effective than just its individual components. Or in the most cases, these conventional drugs, they've isolated the one thing they think is most effective, and then they may be able to recreate that in a lab. That turns into a pill, and that's what your dog is taking. An example of this is white willow. White willow contains the same active ingredient found in aspirin. But in dogs that take this herb, they seldom develop the side effects of vomiting and diarrhea. Yet aspirin will commonly cause this. Here are the 5 most important herbs that you should know about. First, dandelion. The leaves are a very strong diuretic, pretty key for a number of different things, and very safe. The roots are pretty important for liver disease, arthritis, and especially cancer. On top of the fact that dandelion is one of the more complete plant foods you're going to find. Milk thistle, probably the most important herb, in my opinion, natural remedy for liver disease. Aloe in combination with calendula, great for a whole variety of topical or surface skin conditions. Curcumin, which is isolated from the herb turmeric, super key as anti-inflammatory, help dealing with pain, help dealing with cancer, and even being an antibacterial. And lastly, valerian. It's a great one as far as a natural pain relief, as a bit of a sedative. If our animals have these back spasms, it's a real easy one to give. How could you start using herbs with your dog or cat? Obviously, the easiest things to start with are the herbal creams, such as aloe in combination with calendula, or even chamomile as a cream. Many of the natural stores are going to have them already in a cream formation. And they're a real great alternatives to some of the steroid creams for many of these guys that have allergies. Valerian, which you can get as a tincture. It's great for muscle spasms, also great for mild sedation. Typically, I've got the dose of 1 drop per pound. So typically you're looking about a half of a mil per 10 to 20 pounds of body weight, sort of 2 to 3 times a day. I've used it myself. I'm got some anxiety going on. I can't get to sleep. I'll use valerian. I recently had a pretty sore back from just doing a whole lot of lifting, and sure enough, that did wonders for my back. Last one, some of the teas, such as the peppermint or chamomile tea. They're very easy, safe to make, and easy to give to your dog or cat. And both of those, peppermint and chamomile, are really effective for upset stomachs. A little bit about healing with homeopathy. It's one of the more controversial healing modalities. It's a branch of holistic medicine, involves the use of various plants, minerals, and other biological substances in very small doses. The goal is to stimulate a pet's natural healing defenses. It's based on the application of a lot of similars in which a homeopathic medicine or remedy is used to create a reaction that is similar to a symptom of a particular disease. And what I often try to equate it to is a vaccine. You're giving a teeny amount of it. You want the body to react appropriately, and then it can deal with it. The difference with the vaccine is we have all these side effects, etc. Scientific studies, no question, they're sparse, and of all the different things, when I go and discuss the different treatments or home remedies, it's the one I seem to get the most comments on. If there's no scientific basis to it, it doesn't work. Not really truthful, and there's a number of different scientific studies that have gone back and referred back to homeopathy and seen that it is beneficial. And here's one, some research up in the end of 2014. There was 189 peer-reviewed papers. And out of those, 104 were placebo-controlled. So that's kind of the gold standard for a scientist looking at any type of medicine or treatment. And they found that 41% reported positive findings, 5% were negative, 54% were non-conclusive. But the point being, 41% showed like a benefit. The 5 most important homeopathics that you should be aware of or know about. 1, arnica. Comes in different things such as a cream or a tablet called Tramiel. Great for pain, inflammation. Anytime we think of an animal in shock, I would use arnica, and so many clients did and really seen it, and they've really seen an improvement. The second one is called Arsenicum alum. Pretty key one for any of our guys that have garbage gut, vomiting, diarrhea. Third one's called rust tox. Anytime we have soft tissue injuries. Many of these guys say they've been in fights, really respond well to rust tox. The fourth one is called Hepar sulf. Anytime we're thinking of an infection or an abscess. And the fifth one is called belladonna. Anytime we have an animal that has a fever, for instance, or they're having seizures, a real key one to consider. What are some real easy ways for you to start using homeopathy on your dogs or cats? As we talked about with arnica, and you're thinking of pain, shock, any sudden injury, think arnica. A typical standard dose is about 130C tablet per 10 to 20 pounds of body weight, given as needed. If they're acute pain, you can give it every 1 to 2 hours. Vomiting, diarrhea, which I just talked about, especially if your dog's gone out and he's eaten something and he's throwing up. Think about trying Arsenicum 30C. And if you've never tried it, it's an easy thing to do, and you can see, has it been beneficial to your dog or not? 130C capsule per 20 pounds of body weight as needed. Can be given every 1 to 2 hours. Skin infections and abscess. They seem to respond really well to Hepar sulf. And I used to have many clients that have these cats with abscesses, and I'm like, well, I can't afford to bring them in, doc. What else can I try? And at the time, I hadn't even used homeopathy. My neighbor says to try this homeopathic, and so many reported that it really was helpful. So it's Hepar sulf. So you just give your cat 130C capsule 2 to 3 times a day as needed, often for 3 to 5 days. A little bit about healing with acupressure. So there's Lewis, and there's some of the different key acupressure points sort of along his spine. It's closely related to acupuncture, but acupuncture, it's obvious, doesn't lend itself to the do-it-your-home approach. It's easy to perform at home, and every pet owner can do it. So you guys can do this at home. A little bit about traditional Chinese medicine. The cornerstone of it is called qi, and it's called this life force energy that pulses through all life forms. You really have to think about medicine in a different way. And they claim that this qi energy is in a dynamic balance between these two opposing forces. Quality nutrition, natural foods, proper exercise, this natural lifestyle, they help our dogs and cats have a strong and balanced qi. This qi energy flows along pathways or meridians in the body, and it links all parts of the body together, such as the organs, skin, muscles, and bones. The belief is that when a pet gets sick, the natural flow of energy is out of balance. So the thought is that you can correct these energy imbalances by pressing on certain places on the skin called acupressure points. In our pets, there's 361. Obviously, you only need to be concerned about a few of them. I've really had some really good success using acupressure, especially on my last dog, Lewis, who responded really, really well to it. So really don't discount it. What are the 7 most important acupressure points for our dogs and cats? And these are fairly simple ones for you guys to use. And I also have a video. So after hearing me and after the presentation, you can go onto YouTube and once again see me showing you how to use acupressure in your dog or cat. The BL60 KI3 point, I'll have a picture after this to show you where it is. It's in the webbing on the back leg. So you can just run your hand along the back of your leg, and there's that big tendon, the Achilles tendon, and there's a flap of skin between the Achilles tendon and the bone. So in there, so the inside is the KI3 point, the outside is the BL60 point. Hold your thumb and forefinger together and over those. Hold that for 30 to 60 seconds. And sort of consider the aspirin point. The GB4 and GB20 points, these are along the spine, pretty key ones if we're dealing with our dogs that have chronic back pain, hip dysplasia. And GB29 and GB30 points, they're actually right over the points of the hip, in front and behind. I'll show you a slide on this after. The GB26 point, it's a pretty key one if we're having a dog or a cat that is seizuring. It's just in between the nostrils. And the ST36 one, located just below the knee, pretty key one for our dogs that are bloating. Here's where the GB29, GB30 points is located. So you can see it. You can just run your hand up the side of your dog's leg. On the top of the femur, there's a little bone that sticks right out. It's called the point of the femur. It's a part of the bone that comes off the femur. And there's a depression in front of that, a depression behind that. So just use your thumb, your index finger, your middle finger. Put them right on those 2 points. Hold those for 30 to 60 seconds. Do that twice a day for a week if you've got a dog that's got some pretty sore hips, and just see if it's beneficial or not. There's the GV26 point. And interestingly, when we would have an animal during surgery and they're under anesthesia and they're not breathing, I would pinch between their nostrils and that sort of webbing in that little area in between the center of their nostrils. And that's right where the GV26 point is located. And often that would stimulate them to take a breath. So I thought it was the pinching that was causing it. And in some cases, obviously it is. But in other cases, I'm actually going directly onto that GV26 point. Now let's get into the last healing modality, healing with massage. So there's Lewis getting massage, looking most relaxed. No question it feels good to us, to our pets. But there's so much more than just, this gentle, making your dog or cat feel good. It has many therapeutic benefits. Pain management, helping for arthritis, helping heal soft tissue injury, boost your dog and cat's immune system. It can even lower drug doses. It stimulates the release of these endorphins. They're natural chemicals found in the body that relieve pain and promote feelings of well-being. It stimulates the lymphatic and circulatory systems, helping remove lactic acid from sore spots, which helps your dog and cat heal. Some of the medical conditions that your pets can benefit from massage, back pain, hip dysplasia, shoulder injuries, any type of scarring, any chronic injuries, even anxiety. These guys have ACL or knee disorders, breathing, respiratory conditions, and even intestinal disorders. It's not just the soft tissue. That's sort of the primary focus of massage. There's a number of different massage techniques. And once again, I also demonstrate most of these on my YouTube channel. So just Google Dr. Jones YouTube and how to massage your dog or cat. So effleurage is how they often start a massage. It's these long, sort of slow strokes. It's like you're petting your dog or cat from the head down to their tail. Petrissage is you're actually gripping these big muscles. Think about the big quadricep muscles on the top of your dog, your cat's back leg. You're grabbing, gripping, and rolling them. We're trying to loosen up these big muscle bellies before we start finding the specific painful trigger points. And then there's trigger point massage. And most of you may think of that when you think of massage. It's where you're making sort of circular motions on either side of your dog or your cat's back, along these big muscle bellies that are adjacent to the vertebrae. And you're trying to find in doing that, you're trying to find sort of a knot, for instance. And when you do find a knot, you're going to hold that knot in the muscle, hold that for 30 to 60 seconds, and then release. So what we're trying to do is, one, get the blood flow back into that muscle that's in spasm, have it remove some of the toxins such as lactic acid, and get that muscle working normally again. And a couple other ones, there's one called tapotement, is more like drumming, and the other one is called cross fiber friction, where you've got your sort of palms flat along, say, a muscle belly, such as your dog's back, and one is sort of pushing the muscle forward, one is pulling the muscle backwards. They're just different techniques to help loosen up those muscle bellies. The big thing about massage, no question, it's really underutilized in my opinion in veterinary medicine. And it's one I never really took too seriously. We're pretty good in vet practice about getting the big things. We'll take an x-ray, we'll see what's broken in your dog, but we're not so good about sort of paying real good attention to some of the muscles and these painful muscles and how best to deal with them. And this is such a better way to do it. A little bit about dog and cat food, which is, sort of tied into this in such a big way. No question, diet really is one of the huge keys to us being healthy, to our pets being healthy. Our dogs, our cats, they eat so much differently in the wild. Dogs consume their entire prey. They have this rich, varied diet. The bones they chewed on help keep their teeth clean. Cats, they evolved as animals with very poor triggers for thirst. And in the wild, they get most of their water from their prey. Our cats are obligate carnivores, meaning they need adequate levels of animal protein to survive. As that kitty's eating a mouse. The dog and cat food industry now is dominated by these large multinational consumer corporations that really are, obviously, they're most interested in profit. Yes, they claim to be super key on wanting to make sure your dog and cat is healthy. But obviously, profit is what's driving them. Are they all wholesome ingredients, as what you see in the big glossy flyers and ads? Well, the pet food industry, it's an extension of the human food and agriculture industries. Pet food, as it started, it provided a market for animal fat, grains, etc., that were considered unfit for human consumption. And they could turn these waste products into profit. I mean, just think about it. They've got this cow that's been raised in this feedlot. All we want is steaks and burgers and roast. Like, what do we do with things like the udder, the rumen, etc.? Yeah, let's turn it into dog and cat food. But unfortunately, some of these other things that are added in the pet foods included, disease and even cancerous animal parts. And it's not, some people will report back to me that this is just sort of internet hearsay. This doesn't really happen. But here's a big pet food advocate called Susan Thixton. Her blog is called The Truth About Pet Food. If you've never looked at it, I encourage you to do so. So here she recently met with the FDA and asked them directly if the agency will continue to ignore the law, which is supposed to prevent illegal diseased dead animals to become pet food ingredients. And the agency said to her in person that we're going to allow these animals that have died other than by slaughter that are further processed. We will allow those ingredients in pet food, but hopefully people will not use that protein in a raw pet food diet. Meaning that's happening. And where in some cases there are dead, decomposing animals dumped into pet food. The material that's too dangerous for landfill. And this happened not too long ago where there was a euthanasia drug, the sodium pentobarbital, found in pet food. Unfortunately, some animals even died as a result of it. They're opening, and this is a good quality company. I mean, they're pretty particular, but you can't always control your food supply and know where every bit of food comes from. A little bit about problems with grains. They're prevalent. They're the least expensive food ingredients, generally far less costly than animal protein. I mean, what do? They help bind the kibble together. That's how we can have kibble in the form of dog and cat food. Think of them as a form of glue. It's great if you're trying to stick something together, probably not something so good to feed your dogs and cats. So these high carb diets negatively impact our dogs and cats. I mean, our carnivores, our cats, they can't maintain long-term production of the quantity of enzymes such as amylase necessary to properly digest and utilize the carbs, contributing to some of the negative effects. Cats lack an enzyme called salivary amylase, further evidence that they're not designed to digest carbohydrates. They also lack the liver enzyme glucokinase, which is used to break down blood sugar. So after a high carb meal, glucose becomes rapidly elevated, but our cats lack the ability to rapidly break it down. A little bit about some of the toxins in pet food. Some of these include carcinogens, such as preservatives, the artificial preservatives, such as BHA, BHT, and ethoxyquin. Be better if you purchase pet food if you're feeding kibble with natural preservatives, such as vitamin E. Concerns around fish. You have to be thinking about limiting mercury poisoning by avoiding fish byproducts. Fortunately, the higher quality pet foods are trying to avoid fish with high levels of mercury. And there's other toxins, such as the Teflon chemicals. These are things called PFCs, and they leach out a pet food bag coating. So next time you open a bag of pet food, just feel the inside lining. Feel it's sort of shiny. It may be leaching PFCs into your dog or cat's food. Then there's a BPA. It's a toxin that is found not only in plastic, but also in the tins of dog and cat food. There's one researcher that said the interaction of pet health and environmental chemicals is understudied. The amount of BPA and phthalates that we found from toys would be considered on the high end. Think of all those rubber toys that are available for our dogs, for instance, and they're always chewing on them. And there's a direct correlation between canned food ingestion and the incidence of hyperthyroidism in cats. What should you do? And I'm not just telling you this to scare you, but to more than anything inform you and make you more aware of, there's serious concerns about what we are feeding our pets and how that is impacting their health. If you're going to feed kibble, choose quality foods that have good reputations, that are naturally preserved with no artificial colors, no artificial flavors, and preferably no byproducts. As natural as possible. And vary your pet's food. Choose from a variety of quality pet foods. And, I did this with Lewis. I did this with my cat Gussie. I did this with Jessie. I did with Cleo. I tried to really mix up their foods. I rotated them every 2 to 3 months. I didn't just stick with the one same brand. And I also mixed them up. I made homemade diets. I fed them some raw. At least I tried to do that once a week. I just fed Tula her some raw food yesterday, which she was most excited about. It was actually beef. And I would do a moderate amount of canned food along with the dry food, not just the dry kibble. And if you're just a counter on tonight's presentation, ideally you're just feeding a food or a canned type food, so either a raw food or just canned cat food. Because the big thing with feeding our cats in particular is they should be on high protein, high animal protein, no to low carbohydrates, and a really high moisture content. Typically what they would normally get in the wild. And for some of the toys, look at giving toys bowls that are BPA free. Obviously, your dog doesn't need all that rubber plastic to be absorbed. And on top of the fact that some of these toxins are even faster absorbed just under the tongue, and that's what they're doing. They're chewing on them. Here's a list of some of the commercial pet foods that I recommend. It's not complete. These are ones that I've fed or I'm comfortable advising, and I know there's a huge variety out there, especially among individual regions and states. Artemis, Asmira, Back to Basics, Bravo, Canidae, Carnivore, Champion Pet Foods, which include Origin and Acana, Dogdwell, Dr. Harvey's Pet Food, First Mate, Flint River Ranch, Halo, Holistic Blend, Honest Kitchen, Life's Abundance, Newman's Own, Nature Pet Products, Nature's Logic, Nature's Variety, which includes Instinct and Prairie, Pet Curie and Pet Nutrition, which includes Go Now and Summit, Primal Pet Food, Rudy's Grain Dog Food, Solid Gold, Timberwolf Organics, versus Pet Foods, Beyond Wellness, and Wysong. Now a little bit about my course in natural animal care. This is a big course. It includes 119 lectures, almost 20 hours of content, but don't let that overwhelm you. It's all broken down in these small sort of 10-minute lectures, and you're going to learn all the stuff that I'm trying to teach you tonight in a big way and really be able to get it. You're going to learn how to properly examine your dog and cats at home. You're going to learn how to treat your dogs and cats with herbs, homeopathy, acupressure, massage, and nutraceuticals. You're going to be able to determine when it's appropriate to treat your dogs and cats at home, when you need to see a veterinarian. And you're going to become familiar with the most common veterinary diseases of dogs and cats, along with knowing the most effective natural remedies. And then when you complete the course and you pass all the quizzes, there's 120 questions, you can become certified in natural animal care. We've had a large number of clients go through the course. I've had some great feedback from it. They've all found it easy to understand, easy to get through, really, really beneficial. When you order tonight, after the presentation, you're going to get 3 additional free bonuses. First, you start it with my manual, Veterinary Secrets, Natural Health for Dogs and Cats. And that's sort of what you're basing the course is based on. Then my manual of first aid, Pet First Aid Secrets. Then my book of home recipes for dogs and cats. On top of it, Natural Animal Care comes with a 30-day money-back guarantee. And so for tonight only, and just because you're on this presentation tonight, it's going to be offered for $97. After that, it's going to go up to $147. The regular price has been $297. And because I'm really trying to work with the clients that are taking the course, we're really restricting the number of people on it. So it's only been available for 4 or 5 times prior to this. So after the presentation, you go to veterinarysecrets.com/course. Now let's get into some of the diseases, the dog and cat diseases, and some of the at-home remedies. And more specifically, all the alternative options are available. Allergies in dogs. So that is probably the most common question I get asked things about. My dog is itching, he's scratching, he's losing hair, he's got this nasty odor. What can I do, Dr. Jones? Let's try to get back to the basis of allergy. You need to determine the type of allergy. There's 3 main possibilities. External parasites such as fleas, mange mites, Food. For dogs, beef protein is most common. For cats, fish or milk are the most common food allergens. And then there's the environmental allergens, from pollens to house dust mites. What's happening is that the immune system overreacts, causing the severe itchiness. You need to start out by first ruling out fleas or mange. Practice regular flea control. For instance, if your dog has never itched before, or say he went to a kennel and it came back super itchy, you want to make sure he doesn't have lice. Make sure he didn't pick up mange. It may mean you've got to use a conventional treatment, such as a topical thing, like Selamectin, the Revolution. But wouldn't that be nice if that's all you need to do and you cure the itching? Secondly, I really encourage all of you to do a proper hypoallergenic food trial. Here you're feeding a specific type of food that's hypoallergenic for ideally 10 to 12 weeks to see if your dog or cat's allergic symptoms stop. It is a long time, but fortunately over 80% of pets respond at least partially by 6 weeks. Although Labrador retrievers and Cocker Spaniels usually need longer trials. What are some of the 7 natural remedies that are dramatically decreasing the itching? I've actually got a few more in there. First of all, you need to be on omega-3 fatty acids. It's probably one of the most important natural remedies. The big point, though, is you need to be giving a high enough dose to be effective. And we're looking at dosing levels of 1,000 milligrams per 10 pounds of body weight daily. A very inexpensive source is flax oil, where you're dosing it at 1 tablespoon for 50 pounds of body weight. So with my dog Jesse, with slight allergies, he was getting, on top of his food, I was adding in a tablespoon of flax in the morning and in the evening. Cats seem to respond better to fish oil, but they can benefit from flax oil. Some of the herbal creams. So you can either make them yourself or pick those up from a natural house store. Some of the ones to consider topically: licorice cream or licorice gel, chamomile cream, and topical curcumin. I'm making reference to one double-blind study where they compared licorice gel, and they're finding it was more effective. In other words, it was working. But all of these can be beneficial. One of the studies I researched was finding them to be the chamomile cream to be as beneficial as a steroid cream. So don't discount the herbal creams. Heat washing. One of the big things, with the environmental allergens with our dogs is they're picking them up on the surface of their skin. There's a breakdown in the skin barrier. The allergens on the outside, say from the pollen from the grass, gets into your dog's bloodstream, causing this allergic response. So if we can decrease the allergen load, like what's on the surface of their skin, we can go such a big, long way in at least controlling the level of itching. And it may be that you're never going to 100% cure this, but you just want to get it down to an acceptable level that your dog doesn't have to be on some of these stronger conventional medications. So regular washing of your dog's paws after they come in from being outside is one of the best ways to decrease the itching. This washes off the outdoor allergens. You can use a damp cloth or put your pup in the bath. Really don't discount it. Honey for allergies. And I've got a whole YouTube video on this. And the big point is you need to be using local unpasteurized honey. And so what we're trying to do is use, and think of it sort of the idea of desensitization that we just talked about earlier. So typically in conventional veterinary practice, they may diagnose your dog with atopy. This is this inhalant or environmental allergy. And so one of the options is the dermatologist can then determine what your dog is allergic to in small amounts, make up, maybe there's 20 different sort of environmental pollens. Let's make up a regimen of all this liquid, and then have your veterinarian or you inject your dog with a small amount of this over a controlled period of time. It may be sort of once a week for 4 weeks, and then a maintenance of once a month. And the idea is you're slowly exposing your dog to a small amount of what they're allergic to in a sort of microscopic level, that they can learn to tolerate it, form kind of a reaction once they can equate it to a vaccine, and stop itching. And some dogs respond well to desensitization. So the thought is, in many dogs, and I've had a number of different pet owners write in and say, yes, it worked really well, is you can use honey as opposed to this big desensitization, because the honeybees are out there pollinating. They're in all the different plants that flower. And often if your dog is allergic to some of that stuff, it's going to be within the honey itself. So this is what some people done. You're feeding local unpasteurized honey, and you're feeding it the dose of about half to a quarter of a teaspoon per 10 pounds daily. But you're giving it for 8 to 12 weeks. And a number of different kinds have said it really, really worked. Licorice root, it can be used with care, but not meant for long term. It's sort of considered the natural steroid. The dose is 50 milligrams per 10 pounds of body weight of the dried herb, or 1 drop per pound of body weight twice daily of the tincture. So say you've got this acute allergic flare-up, you're like, oh, is there anything else I can give? You can try the licorice root tincture. And so it's about a half a mil, if you look at the dropper fill, per 20 pounds of body weight, and given 2 to 3 times a day. Ideally only for sort of 5 to 10 days. Antihistamines, both natural and conventional. So the most commonly used conventional antihistamine is Benadryl. And I use this on my dog Jessie anytime he really big flare-ups. I'm like, okay. So I gave my 50-pound dog Jessie 25 milligrams of Benadryl. It's 0.5 milligram per pound at night. Sometimes I gave him 25 milligrams in the morning, 25 milligrams at night. Vitamin C is another antihistamine option. It has some antihistamine qualities, and some pet owners find that it does help. The vitamin C dose is 100 milligrams per 10 pounds of body weight twice daily. And lastly, this one herbal antihistamine is nettle. And I recently did a video on using nettle and making a nettle tea. So the big point is you can just get dried nettle. Lots of natural health stores have it. It's, aside from causing the stinging, when you dry it, when you cook it up, it's super nutrient dense. It's got a whole pile of beneficial things within nettle itself, being rich in B vitamins, being rich in iron, and also being a pretty nice antihistamine. And so we're looking at making it a nettle tea. You're going to get about a teaspoon per 10 pounds. So say you've got a 50-pound dog. Give him a tablespoon twice a day. So you want to make enough for a day's worth. Put in 2 tablespoons of nettle leaves. Mash those up. So you want to grind them up pretty fine. And you could add about a cup of water and cook that up for 10 or 15 minutes on the stove. So it's and after about cooked up, it'll be down to about a quarter of a cup of water left. And that's all you need. So then you're going to give half of that in the morning, half of that in the evening. And once again, I had a number of guys have written in to say that has been helpful for them. It takes about 1 to 2 weeks. It's not like it's going to give you an instant result, but it's safe to give. It could be beneficial. Don't discount it as an option for dogs with allergies. Some of the new topical therapies, it can help the skin barrier. That's what we have, the breakdown in the skin barrier. One is called Allerderm Spot On. It contains these essential fatty acids, and it's applied topically, similar to how you apply the monthly flea control medications. It's available through your veterinarian. A little bit about cat urinary tract problems. Do you need the expensive prescription food? Some of the holistic solutions that work to stop your cat's urinary tract infections. Here's a kitty who's obstructed. He's unable to urinate. He was at my practice, the Nelson Animal Hospital. And that's what you don't want your cat to get to. So what is FLUTD, feline lower urinary tract disease? Your cat will be frequently urinating, straining to urinate. He or she may have bladder pain. He or she may excessively lick their genitals, and there's often blood in the urine. Sometimes they're going to urinate outside the litter box, preferring cool, smooth surfaces. The disease is so named idiopathic because we really don't know the underlying cause. What we do know is there's marked inflammation of the bladder lining is thickened, and the resulting blood in the urine. Some are related to diet. There may be bacteria or viruses that affect the bladder. It may be that the immune system just simply overreacts and attacks the lining of the bladder wall. Or it can simply just be a response to stress, such as having another cat in your house, not letting your cat go outside. There your cat is. He's sitting in the window looking outside of the other cats. And that stress can lead to inflammation, and it shows up within their bladder, which we never thought 20 years ago when I first started in practice, 30 years. I'm starting to date myself. 30 years ago, when I first started working as a veterinarian, where there was just no one would have ever imagined that stress would cause disease, and now it's recognized. Yes, it does. First, if your cat is straining to urinate, not producing any urine in any animal, the first thing is getting them examined as soon as possible. If they're blocked with a bladder stone, they're going to need emergency care. They're just a block with whatever urolith, anything that's stopping them to urinate. And in general, it's a good idea to have the urine checked for any urinary tract problems. Then you're able to know what's going on, what is the most appropriate remedy to use. Here's somebody getting some fluids. In all cases of infection, regardless, additional fluid intake is mandatory for the treatment and preventing recurrence. For cats, I suggest feeding only canned food. The other big thing for most cats, any type of quality canned food will be helpful, not just the veterinary foods. The high protein foods produce a slightly acidic urine, and the canned food dramatically increases fluid to flush the bladder. Before I talk about the next thing, the other thing with fluid therapy is if you've got a cat that has recurring bouts of this FLUTD, it's a good idea for you to learn how to give sub-Q fluids or fluid under the skin. And I've got another video on it in my YouTube channel showing you how to do this at home. Because some of the thought is just by you're putting fluid, this is a lactated ringer, so it's a IV fluid that we normally give by IV. You're giving it under the skin. Gets absorbed on your cat's skin, makes its way into the bladder. The act of the additional fluid going into the bladder will stretch the lining of the bladder. And that actually gives some pretty good pain relief, so your cat feels better. Secondarily, too, that's going to flush out, say, some of that additional blood, those inflammatory cells. That's going to help heal this condition. Some cases, so it doesn't. So that's all they may need. They may not need to be on anti-inflammatory pills. They may not need to be on any type of antibiotic. Just that. So it's a really good thing to learn how to do. One thing to consider. Heal away. It's a natural pheromone. And so these are these natural hormones, and they can convey messages of peace and contentment. So your cat's rubbing up against you or another cat, he's leaving a little bit of this pheromone. So some wise company has figured this out, and they've created a product called Feel Away. And it contains these natural facial pheromones. It can be sprayed in your cat, or you can use it as a diffuser. And a lot of guys really respond well to Feel Away. And so we know we decrease the anxiety in your cat, less bouts of FLUTD. Natural anxiety relief, you can also consider Bach rescue remedy to make your anxious cat feel calmer, more secure. We're looking at doses of 1 drop twice daily in your cat's mouth. You can try it for 3 to 4 weeks, see if it's helpful. Lavender essential oil. Excuse me, lavender has been shown to decrease anxiety, can be very helpful for cats with FLUTD. It's one of the easy way to give it, and I did with my last cat, Gussie. I was putting about 10 drops of lavender in a cup of water, have this little diffuser, and she was sleeping downstairs on the couch. I had on this little table right beside her. Sure enough, when we put the lavender on, she was quiet throughout the night. Prior to that, she was having these horrible bouts of yowling. So once again, it decreased her anxiety. If she had had this FLUTD, I would have tried this as well with that too. Glucosamine and chondroitin. They're 2 supplements. Glucosamine is anti-inflammatory and helps rebuild the damaged bladder lining. Chondroitin helps prevent the wall from being broken down. And we're looking at doses of 100 milligrams per 10 pounds daily of glucosamine, 50 milligrams per 10 pounds daily of chondroitin. Both glucosamine and chondroitin are in my Ultimate Feline Supplement, which supports your cat's urinary tract health. My dog has a small fatty lump on his chest. What is it, Doc, and what can I do? So that's Jesse, and under I got him holding up his left armpit, and you can see his lipoma. First, examine them. Assess the severity of the lumps. And some basic principles. Lumps that are regularly shaped are less likely to be serious. Lumps that move easily under the skin are usually benign, such as fatty tumors or lipomas. Lumps that grow slowly are likely benign. Lumps that discharge a cheesy material are usually sebaceous cysts and can often be left alone. Aspirate it. So a simple thing to do to determine if the mass is serious is just visiting your veterinarian and have him or her sticking a needle into it. They're sticking a syringe and a needle, aspirating a small amount of it, putting it on a slide. Often right there, they can tell if it's serious or not. Most times you could diagnose a lipoma by that simplified needle aspirate. Compress. Generally, these guys have cysts. They're enlarged and they won't rupture, but sometimes you can put a hot compress on them twice daily. Because what we're trying to do is loosen up that cystic material and also open up the duct where the cyst is supposed to drain to, for instance. Because it's plugged up where the material has gotten too thick. So it means just putting on a hot cloth, a little hot enough that you can touch your skin and just let it cool down. You're leaving it on for 5 or 10 minutes. Do that twice a day. Do it for a week. See if it's helping to loosen up that cyst. Stimulate the skin's immune system. Vitamin E and essential fatty acids are really great for boosting your pet's skin immune function. We're looking at doses of 100 IUs per 10 pounds of body weight daily of vitamin E. For the essential fatty acids, you can use flax oil or fish oil. Green tea weight loss. I put this one in here because many of our dogs have these multiple lipomas or these benign fatty tumors. They don't necessarily need surgery, but it sure be nice if you could shrink them. So green tea may increase metabolism, shrinking lipomas. So one, you could just make tea and substitute it for water, actually what I'm actually drinking now. Or you can use standardized green tea extract. It's dosed at 50 milligrams per 10 pounds of body weight daily. Another option is using colostrum. So it's a supplement I've talked about sort of as immune support, helping prevent a number of different infections. But it's also being used by athletes. It actually increases their metabolism and helping to increase lean muscle mass. So we know that it'll also increase metabolic rate. So it may help deal with shrinking some of these masses or some of these growths. We're looking at colostrum doses of 100 milligrams per 10 pounds of body weight twice daily. It's an interesting one, and in part, I want to speak a bit more on it because I have a friend who currently has cancer now. This is someone who had a dog with cancer on chemotherapy. What are some other holistic options? Great question. There's so few you're given or talked about. So I'll talk about some of the basics and I'll highlight what I think is most important. So first of all, there's the whole range of chemotherapy. You're gonna sorry, that's my new dog Tula, who's just heard the door open. You're gonna go see your veterinarian. Likely you're gonna have it diagnosed. This is what your dog has, your cat has. Here are the conventional options. Ideally you could get surgery done, remove it, but that's not always the case. And we're thinking of some of the cancers, such as this lymphosarcoma, for instance, where the cancer of the lymph nodes and the lymph cells. Your options there are not surgery, and you're looking at chemotherapy, which is just going to put that lymphosarcoma into remission. It won't cure the disease. So you need to be looking at other alternate options. So one, consider the flavonoids. So these are ones, when we think of the colors of the fruits and vegetables, those are specific ingredients within the line, say, for instance, quercetin, which is found in apple peel, for instance, or a soybean has genistein. It's really important that if you're going to give a supplement, such as a flavonoid supplement, you're going to purchase a mixed bioflavonoid product that contains the flavonoid found in green tea called EGCG. The dose for a 10-pound dog or cat is 250 milligrams per day. There's a supplement called ApoCaps. It's a nutraceutical supplement, which is getting pretty good reviews from dog owners, along with many veterinarians. It's got a combination of flavonoids and herbal ingredients within it. And if you look at their website, what they're saying is it helps dogs by unlocking the natural biologic process called apoptosis. So what that means is in cancer, you have uncontrolled cell growth, where these cells are growing and growing and growing. Normally, a cell grows to a certain point, say, for instance, a red blood cell, your body produces them. Your red blood cell does its thing, and eventually it comes to an end of its lifespan, and then it gets broken down by the liver as it dies. And we have new red cells being produced from the bone marrow. Whereas in cancer, it's just this uncontrolled cell growth. And we want, those triggers to happen again. We want these cells to die. So that's what some of the claims from ApoCaps. And it's inducing this apoptosis, which is blocked. And that's what's allowing these cancer cells to grow so fast and uncontrolled. Artemisinin or wormwood, an eighth one. So when the active ingredient comes in contact with cells that have high iron concentrations, which is common in many cancer cells, the molecule becomes unstable and the cancer cells die. So this is there's one type of cancer my first dog, Hoochie, had, and he died of a cancer called hemangiosarcoma. It's a cancer of the lining of the red blood cells, and it spreads via the lining of the red blood cells. It causes new blood vessel growth. So it's one where many alternative veterans have used, especially for hemangiosarcoma. So the artemisinin dose is 20 milligrams per 10 pounds of body weight daily. Curcumin, definitely don't discount it. If I have anyone, even you want to consider me being on this preventively in the first place. So here's one clinical trial. They were giving curcumin to patients who had precancerous changes. It was stopping the precancerous changes from becoming cancer. They know that in some countries where they have pretty low rates of certain types of cancer, where people are eating curcumin at levels about 100 to 200 milligrams a day. Excuse me. Before I finish, so the big thing with curcumin, if you're going to give it as a cancer therapy, I think you see pretty high doses. So you need to be giving a 95% curcuminoids, and you're giving it the dose of 100 milligrams per 10 pounds of body weight twice daily. And the last thing you need to be making sure is that you're giving it with fat. So your dog needs to be eating, having some food going in, especially fat, because it's fat soluble. And if you just give it on its own, you give it with water, it's very little of it gets absorbed. The last one, really don't discount this one, called dandelion root extract. So it started out where we had there's 2 or 3 elderly patients. They had end-stage leukemia. This is at a cancer clinic in Windsor, which is in Ontario. They were told that they'd gone through 3 rounds of chemo, and they're so, we can't help you anymore. You should just go home, make amends. We can't help you. So one older lady started treating herself with dandelion root tea. She responded, became cancer-free. She told someone else in the clinic. They responded. They became cancer-free. Then the next thing you know, the clinic said, we got to look into this. So since then, they've actually extracted some of the specific ingredients that are in the dandelion root itself. They're really shown to have some pretty impressive results in terms of treating some pretty serious types of cancer. So right now, the study is only confined to leukemia, and it's you have to qualify to be in the clinical trial. There are no references yet to using it in dogs or cats. But dandelion root itself is particularly safe and potentially very effective for cancer. And in hindsight, I would have liked to have had my last dog loose on this a lot earlier. The big point in giving it is when you want to order in the raw dandelion root. So a herbal supply company, ideal. So you're getting in the dandelion root. Then secondly, you want to grind it in a coffee grinder. So you want to grind it all up. So making it into small particles. Because we know if you grind it up small, then you're going to release some of the specific supplemental, some of the ingredients that are anti-cancer. And then the next thing you're going to do is after you grind it up, and so you're looking at a dose. They're saying so for an average person would take about 2 to 3 tablespoons. So it'd be about a teaspoon per 20 pounds of body weight daily. So say make enough for a day. Say you've got a 50-pound dog making 1 tablespoon. So put a tablespoon of dandelion root in about a cup of, you could do it about a cup of water. You want to cook that for about 50 minutes, just a light simmer, and just let it cool down. And ideally, you can grind the stuff ahead of time. Say you make about a week's supply, keep it in a closed container in your cupboard. You want to make that daily. And by grinding it up and then simmering it, that has the best way of bringing in some of the specific ingredients in the dandelion root that are anti-cancer. And I'm going to do another post on this. I'll be doing a specific video actually ordering in the dandelion root and grinding it and show you guys how to make it. And but if I was to have an animal with cancer again, it'd be one of the very first things I'd get them on. Medical marijuana for dogs. Well, CBD, it's one of 85 chemical substances known as cannabinoids, which are all found in the cannabis plant. CBD is non-psychoactive. THC is the psychoactive ingredient that's only found in small amounts in the CBD oil products, but both have therapeutic benefits. The cannabinoids possess anti-proliferative and pro-apoptotic effects that are known to interfere with new blood vessel growth, neovascularization, cancer cell migration, adhesion, innovation, and metastasizing. So have all these beneficial effects from helping animals with cancer. What are the CBD doses? We're looking at doses of 1 milligram CBD oil per 10 pounds of body weight twice daily. Ideally, you want to have about 10% THC in the oil, which is helpful for cancer, along with helping for pain and pain control. And my last dog, Lewis, he started out on that specific product called Phoenix Tears, and it was sort of on a 10-to-1 base. But I dosed him at the level of 1 milligram of CBD, and he ended up being ultimately on 10 milligrams. And he ended up going on twice daily, and he did really, really well. So well for pain control. I had him on fentanyl, that didn't help. I had him on tramadol, that didn't help. I had it on tramadol in combination with Medicam, that wasn't helping. The only thing that gave him great pain relief was the CBD. Arthritis in pets, non-holistic options that you're probably not aware of, but are surprisingly effective. I'm going to run through some of these, you guys. We're already up at 6 o'clock. First, thanks for sticking through with me tonight, you guys. I see we've already been on here for about an hour. First of all, the basis of anybody with arthritis is glucosamine, chondroitin, MSM. These are all in my supplement, Ultimate Canine Health Formula, where you're looking at 500 milligrams for 40 pounds daily of glucosamine, 250 milligrams for 40 pounds daily of chondroitin, and 500 milligrams for 40 pounds daily of MSM. SAMe, or adenosine methionine, is a potent antioxidant, being used for liver disease, and does have a protective effect on the joints. We're looking at doses of 100 milligrams per 10 pounds of body weight given once daily. This is a topical one called capsaicin. It's the active ingredient found in chili peppers, making them hot. So it's one you can consider doing topically, one, so long as your dog's not licking it excessively, and two, you can get it through the fur, so it'd be great if you've got a dog that has knee arthritis, you want to try a topical treatment. Ginger. I just recently have just talked about ginger. So ginger extract, an easy way to give it is just getting fresh ginger root, grind it up. Once you can throw it in a coffee grinder or chop it up really small and just make a tea. And you're looking at doses of about a quarter to half a teaspoon for 20 pounds of body weight, and just give that daily with your dog. And once again, do something similar to what I described with making the sort of the dandelion root extract tea. You could try just adding it directly to your dog's water. It will really help for inflammation. And one study I read said that if they could substitute ginger tea as opposed to black tea in extended care homes, they thought in many cases they could decrease the nonsteroidal anti-inflammatory drug use by 50% and go potentially decrease the side effects by up to 75%. Curcumin, which we just talked about earlier, you're looking at the 95% curcuminoids. You're looking at doses of 100 milligrams per 10 pounds of body weight daily. You really want to make sure you're giving it as a capsule because it's going to stain everything orange. Acupressure massage, some of the same ones we just talked about when we started out the presentation. The BL60, the KI3 point, is called the aspirin joint. The GB29, GB30 point for dogs that have hip dysplasia. This is one study where they were showing how anti-inflammatory side effects were dramatically decreased when colostrum was added in. So it's natural supplement we just talked about. We talked about for weight loss. So it's that the first milk, the first mother's milk. And initially, many of the veterinarians have really discounted it because the thought is that it's only effective for animals, in their first sort of week of life. After that, it just hits the stomach, is broken down. No, that's not the case. There's been a pile of research into colostrum. Unfortunately, it just hasn't made its way yet into sort of conventional medical and veterinary practice. But here's one showing huge benefits. The subjects taking NSAIDs for 1 year generally suffer from a variety of gastrointestinal adverse effects. Colostrum was shown to reduce NSAID-induced gastric injury. So if you've got a dog who's on chronic NSAID use, it'd be really nice if they're also on a colostrum supplement. And I do have colostrum in my supplement, Ultimate Canine Health Formula. DMSO, it's an organosulfur compound. It's a colorless liquid. It penetrates the skin very readily. We used to use it in veterinary practice, in particular to bring sort of topical medications to an affected area, and specifically bringing medication into the joint. So it alone may be beneficial for pain relief. Like you could just be spraying it on the inside of or rubbing it on or spraying on the inside of your dog's knee. A couple different options. In vet practice, I used to combine lidocaine, which is a local anesthetic, for these really painful knees, along with an anti-inflammatory such as Voltaren or a narcotic such as morphine. Holistic option, you can combine the DMSO with something like arnica gel or Traumil. Devil's Claw, another herbal supplement, has been shown to be really helpful for people with osteoarthritis. They're looking at doses of 10 milligrams per 10 pounds. This is one that's very popular in Europe called avocado soybean unsaponifiables, or ASUs. The doses of them are 20 milligrams per 10 pounds of body weight daily. It's a natural vegetable extract that has been shown to reduce the symptoms of osteoarthritis, even slow progression of the disease. And a little bit more about CBD oil for pets. So CBD has been shown to have potent anti-arthritic and therapeutic action, resulting in both joint protection and clinical sign improvement. On top of the fact that it has not been shown to elicit any negative side effects. So once again, the CBD oil dose is 1 milligram per 10 pounds of body weight twice daily. The other big thing, is we're just in the process of having it legalized in Canada by next year. There's obviously different rules among different states, but if it's available to you, really consider it as an option. And I've just seen so many good things just with my own animal, talking to different pet owners, some really, really good results. Kidney disease, what are some of the better options for you guys? So first of all, I'm going on the preference that you've, on the thought that you've had your cat diagnosed with kidney failure, or your dog, and you're maybe using some of the conventional options, and what are some other sort of alternative thoughts to think about? First of all, I think it's more important to focus on phosphorus production. So in the early stages of kidney disease, the single biggest mineral that is damaging the kidneys is phosphorus. This is the mineral that is speeding up destruction of the remaining kidney cells. So you want to be feeding a diet lower in phosphorus and using phosphorus binders. Just a second. I'm just going to let my pacing dog out because she's going to make me crazy. Second, aluminum hydroxide is a phosphorus binder, and it's one you can order it online. I just thought it was even available through Amazon. The dose is 1/4 teaspoon per 10 pounds of body weight daily. You want to be feeding your cat canned food only, but in particular, not necessarily feeding quote unquote low protein. The big thing we know now is that, especially in the early stages of kidney failure, it's the phosphorus it's the phosphorus in it that is damaging the kidneys, which is causing the progression of kidney disease. And if you restrict protein too much, you're going to have other negative effects throughout the rest of your cat's body, because they need protein just to survive and just to have the rest of their basic cell processes to work properly. So if you restrict too much protein, initially in vet practice, that's what I was taught, and we used to just send these cats home with low protein cat food. Now that's only really applicable in the really serious end stage kidney failure, because we know it's the protein toxins, urea and creatinine, that build up. But initially, it's just a senior type cat food, slightly lower in protein. I know that there's a herb called bromelain, which has been shown to reduce inflammation and disease progression in certain cases of kidney failure. The bromelain dose is 100 milligrams per 10 pounds of body weight twice daily. This is a good one to consider. It's called some of the anti-nausea meds. So pets with kidney failure often feel sick. The two primary kidney toxins of urea and creatinine can make your cat vomit, drool, and generally they just want to eat. They're inappetent. And one over-the-counter remedy that was shown to work really well is there's a drug called famotidine. It's sold under the brand name Pepcid. So the typical cat dose is 0.25 milligram to 0.5 milligram per pound every 12 to 24 hours. So meaning your cat would get about 1/4 of a 10 milligram tablet once daily. Lots of guys really, really respond well to it. You've got a coughing dog. Many people, my dog's coughing. Are there any holistic options at all? First of all, you want to add additional steam. Like adding humidity to the air will calm any irritated airway. You can put on a humidifier, put your dog in the bathroom, and turn on the shower. An easy thing to do. Just really soothes that irritating airway. Second, you really want to look at giving a natural cough syrup. So ideally, you're looking at honey is sort of the basis of it, along with some lemon. And what I've generally advise, if you can get local unpasteurized honey, great, but any honey can be helpful. So you make about a tablespoon of honey and about 1/4 cup of some hot water, mix that up, and add in about 1/4 teaspoon of lemon juice. The biggest thing is the honey in the water, and really mix it up really, really well, and just use that period. New research points towards natural dark honey being more effective than any over-the-counter cough suppression. Because I used to say just buy cough syrup, but that was just more than anything giving clients to do. Now knowing full well that cough syrup is very ineffective. Licorice root, it's a herbal supplement. It is also an effective cough suppressant. We talked about using licorice root as sort of that natural steroid helping stop your dog from itching. Once again, you're using it short term, just somewhere between 3 to 5 days. You're looking at a tincture dose of about a half a ml per 20 pounds of body weight, 2 to 3 times a day for 3 to 5 days. Dandelion, which we just talked about. So here we're going to use the dandelion leaf. So the dandelion leaf is the strong diuretic, and it can help get rid of some of the excessive fluid. So when you've got this inflamed airway, you get the fluid buildup within the lining of the airways, the bronchi within your dog or your cat, causing that coughing. So if we can get rid of some of that fluid, they're going to cough less. A real simple option, dandelion root. You're looking at tincture doses of about a half a ml per 10 to 20 pounds of body weight twice daily. There's a couple of homeopathics that can be helpful, belladonna and pulsatilla. Belladonna is used with a dry cough. We talked about belladonna also being used for seizures. Pulsatilla is used for a cough that is dry at night but loose or productive in the morning. The dose is 130 capsule per 10 to 20 pounds of body weight 3 times a day. Do I think that over-vaccination can compromise the immune system of a dog and lead to autoimmune diseases in later life? Great question. Well, let's just talk about dog and cat vaccines, period. The short of it, in my opinion, we're giving too many vaccines far too often in the incorrect way with serious short-term and long-term side effects. Some of the negative effects of vaccines. There's immediate and short-term reactions to vaccines, including anaphylaxis, these acute allergic reactions. Local reactions, which cause swelling, abscess, systemic reactions, fever, loss of appetite, weakness. And then I think even more serious are the sort of immune-related and long-term diseases, such as immune-mediated hemolytic anemia, immune-mediated skin disease, thyroid disease, vaccine-induced skin cancer, skin allergies, just to name a few. There are links to most of the common chronic health diseases of dogs and cats due to over-vaccination. Here's what you need to know. In my opinion, is do a really modified vaccine regimen. If you got a puppy, and if I'm to get a puppy again, which I'm sure I will, I would be giving a vaccine at 8 weeks, parvovirus and distemper virus. I'd boost that again at 12 weeks with parvovirus and distemper virus. I'd only give a kennel cough or bordetella vaccine if I was going to a kennel or a puppy class and it was required. And if I needed to give a rabies vaccine, I'd at least wait till 6 months. And that was only if required. For cats, I would do FVRCP booster at 8 weeks. So that's the 2 respiratory viruses, feline viral rhinotracheitis and calicivirus, and one of the feline distemper or panleuk. I'd booster that again at 12 weeks. I'd wait to give the rabies vaccine at 6 months if required. And my current advice is to then have your dog or cat titer tested at a year of age, seeing if they have protective immunity, and if so, they may need no additional vaccines. If not, then give booster vaccines. And if they didn't have protective immunity, then you could give the booster vaccines at a year. But I think in most cases, that's for many, many, many dogs and cats, that's all they're going to need. The booster at 8 weeks, the booster at 12 weeks. And the other big thing to remember is that most of those diseases happen within that first year of life. I mean, they don't happen beyond that, these infectious disease. And here's this young little healthy kitten and this older dog. Some of the vaccines not advised for dogs. Coronavirus, leptospirosis, Lyme disease vaccine, Jardy vaccine. For cats, I don't think you need to get FIP, feline bordetella, FIV, limited use of feline leukemia vaccine in cats. Some of the homeopathic treatments after vaccines that may help mitigate the side effects. So many of the alternative veterinarians, the homeopath, advise giving a dose of Thuya 30C, wait a week, and then give a dose of sulfur 6C once daily for 7 days. But if you're going to give one thing, it would be to be giving the Thuya 30C. And I just want to finish with the last thing where I talk about the vaccines, is that, there still are serious infectious diseases, and the small community where I live, they still regularly do see canine parvovirus. So if I were to get a puppy, I would give him the parvovirus vaccine. I would give him the distemper vaccine. Honestly, I would just do the 2 doses at 8 weeks and 12 weeks. We really don't have rabies in our area. I wouldn't vaccinate for rabies. Likewise with the cats. We see the respiratory virus is very common. We still do see feline distemper or feline panleukopenia. So I give those, but just at 8 and 12 weeks. And I would do a titer test at a year. And that's about it. I mean, with my current dog Tula right now, I won't be giving her any additional vaccines. Only thing would be if we do travel to the US and we're required to have a rabies vaccine. But that would be it. Is there holistic treatment for diabetes that I can try? Great question. So a bit about diabetes. It's a result of the pancreas not producing enough insulin to allow the body to utilize blood sugar. This results in high blood sugar levels, causing increased drinking and urination. The blood sugar becomes markedly elevated after a large carbohydrate meal. But we're feeding all this carbs, but we have pets, but they lack the ability to rapidly break it down. So just think about this. We're flooding your pet's blood with blood sugar they can't break down, overwhelming their pancreas, ultimately seeing a decrease in insulin production and subsequent diabetes. Sort of makes sense if you think about it. Why more and more animals are becoming diabetic. Too many carbohydrates. The mainstay of treatment is diet. 99% of animals need to start on insulin, but many are able to have decreased insulin doses. Many cats in particular are often able to come off of insulin if we can get them on the right diet. We're eliminating carbohydrates, feeding a canned or raw high protein food. That's a big bone that guy has. No question, diet gives your cat in particular the greatest chance of coming off insulin. And in practice, I was finding upwards of 50% of diabetic cats could be controlled just with the high protein canned food. Cinnamon, it's a tasty spice, has been helping to show and regulate blood sugar. The dose is 1/4 of a teaspoon per 10 pounds of body weight daily. And this is a pretty key supplement called alpha-lipoic acid. It appears to help increase insulin sensitivity. It's also been used for pancreatitis. It's been used for any of the animals that have, say, cognitive dysfunction. It's one of the few antioxidants that can cross the blood-brain barrier. The dose is 10 to 50 milligrams per 10 pounds of body weight daily. A little bit more about my course in natural animal care. Thanks, you guys, for sticking through here. First of all, you're going to get personal access to me, Dr. Andrew Jones. I'm going to be there guiding you. We have a discussion forum, and you're going to get my personal email. You're going to learn how to naturally treat disease, learn how to avoid conventional veterinary medication side effects. You're going to develop the skills and confidence to better care for your dogs and cats at home, and you will save on veterinary fees. And then when you complete the course and you pass all the quizzes, you're going to become certified in natural animal care. So for tonight only, natural animal care is being offered for $97. Tomorrow it's going up to $147. After that, then 4 or 5 days, it'll either be $297 or it won't even be offered. So now let's get into the last part of the presentation. The secret remedy in your kitchen, honey. Due to its natural anti-inflammatory effect, honey will help heal wounds more quickly. There's a whole variety of different products making it so beneficial. It's a natural antiseptic. In this one study, the researchers singled out three particularly nasty bacteria, 2 strains of staph called MSSA, methicillin susceptible, methicillin resistant, Staph aureus, and Pseudomonas. And what worked most effective was honey, better than any antibiotic, according to past research. Any wound can have honey applied to it. Typically, it's going to be speeding up closure of an open wound. An example will be a dog or cat abscesses. Wounds such as cuts, grazes, scrapes, when covered with honey and a bandage, such an excellent healer. The next time you or your pet has a bite, cut, or wound, I encourage you to try honey as a remedy. I've used it myself several times, use it with my animals. They respond so well to it. Eye infection, what are some natural options? Well, conjunctivitis is defined as inflammation of the red conjunctival tissue around your pet's eye. It is the most common cause of red eye in dogs and cats. There are many at-home remedies that can be used for conjunctivitis. First, here are 3 signs to trigger an immediate call to your vet. So if your pet's eye infection is very painful, your pet is really rubbing his or her eye, if the main part of the eye, the cornea, appears to be indented or layered, if the entire eye suddenly becomes cloudy, or if the eye appears to be bulging, go see your vet. Don't try the home remedy. But if it's just this red inflammation and there's just a bit of eye discharge, then consider some of these options. First, tea. It's more than just a drink. It has tannins, which are anti-inflammatory, and also have antimicrobial properties. You can just brew up a strong cup of black tea and place 3 to 4 drops in the affected eye 3 times daily. There's a herbal supplement, an eye drop called Euphrasia. So you can make it yourself, but it's pretty easy to purchase now. It's just at my local co-op, and it's the easiest way to give it. It's called Eye Bright as a supplement, and I find many pet owners that it's worked really well for their dogs and cats with eye infections. A dog with recurring bladder infections. What are some of my thoughts? But some additional things to think about are first probiotics, because we want to get that good bacteria back in the intestinal tract, and they seem to have anti-inflammatory qualities, as well as help decreasing the likelihood of the bacteria from recolonizing the bladder. And if any of your animals are on an antibiotic, especially for a urinary tract infection, it's a really good idea to then supplement with the probiotic. The most common one is Lactobacillus acidophilus. We're looking at doses, they're measured in called CFUs, or colony forming units. So it's 100 million CFUs per 10 pounds of body weight daily. So in all cases, additional fluid, you're just feeding your canned cat food. Learn once again how to give sub-Q fluids, which we talked about earlier. A couple herbs. One is marshmallow. It has many qualities, making it a first choice for eating bladder stones. But it comes as a herbal tincture. We're looking at doses about a half a ml per 10 to 20 pounds of body weight twice daily. Dandelion leaf, which I talked about earlier, is a key diuretic. It's going to draw additional fluid into the urinary tract, and the simple act of flushing the bladder will help in many cases of simple infections. A half a ml per 20 pounds of body weight twice daily. Honey. It's been indicated that dilute honey help treat urinary tract infections because certain bacteria causing UTIs were found to be sensitive to the enterobactivity activity of honey. So you're looking at honey doses of about a half to 1 teaspoon per 20 pounds of body weight daily. I'm going to add some questions around the flea med, such as Advantage. They're causing a whole variety of problems. While I was in veterinary practice, I commonly saw small dogs and cats with side effects. Skin irritation, hair loss, vomiting, and diarrhea. In a few cases, and most of the time I had pet owners that purchased stuff topical for dogs, not even through the clinic, often through a big box store, applied it to a cat, the cat licked it, and they died. You really should be thinking about holistic options for flea control. Shampoo. You can use a flea shampoos combined with oatmeal. Or there are other sort of more natural type flea shampoos, but generally, just the pyrethrum-based flea shampoos work really well and they're very safe. Cedarwood oil spray, it's non-toxic, natural, has been effective against fleas. The one I've used is called Triple Sure Natural Flea and Tick Spray, made by Natural Wonder Products. And anytime you're spraying any of the essential oils, you want to be really cautious on small dogs, and just lightly mist them and use a flea comb to spread it around. Borax, the natural occurring mineral, and it's a really good one for flea infestations. It kills fleas by dehydrating them. The other one to consider, which you can use topically on your pet as well in your cracks and crevices in your house, is diatomaceous earth. I recently did an article on diatomaceous earth. Really, really like it. I've actually used it for a variety of different things. It does work really well for fleas. It's this fine powder. It looks more like flour. It's very safe for your pets to consume, safe for you to consume. Just make sure when you pick it up, it's the one that is sort of considered for it's pet safe or people safe. It's meant to be ingested. Other people also use diatomaceous earth also to treat internal parasites. Dog with recurring ear infections. Do I have any thoughts on that? So the big principle here is, first of all, most dogs with recurring ear infections have yeast. So you need to be treating yeast. Secondly, you need to start out by cleaning the ear. You have to treat the infection and then stay on top of it. You're probably going to have to weekly treat that ear. So you can consider, of all the different home remedies, vinegar is as effective as anything else. Effective against yeast and bacteria, very effective against yeast. Also even effective against Pseudomonas, this pretty nasty bug that no antibiotic seems to work on. But if your dog has run open wounds, don't use vinegar. It's super painful. You just want to use a soothing topical first, such as olive oil and vitamin E. So apple cider vinegar in particular is naturally antibacterial and antifungal. I put here a 1-to-1 rinse, and I'm gonna have to go modify these slides. Because last time I did it I tried to do a little test with Lewis, and then I ended up doing about a 5-to-1 rinse. So I did about 5 parts water, and then I did 1 part apple cider vinegar. And the last one I did an apple cider vinegar, 1 part apple cider vinegar, and about 5 parts of green tea because it's antibacterial. So I use that as a rinse, and it's a real good option because you're instead of just using water, you're using green tea as the base of the fluid. Then I added in about 1/5 of apple cider vinegar, and it wasn't super irritating, but was really effective in terms of dealing with the ear infection. You're going to apply it twice a day for 5 to 7 days, and then sort of once a week as a rinse. Another one last option to really think about is topical antifungal. This is called clotrimazole, and that is if you go pick up an ear medication from your veterinarian, there's a number of different brands, but often they have clotrimazole as the antifungal within them. Maybe there's a couple different options. One's called Suralan, for instance. But often they have this specific antifungal. And if your dog has this sort of blackish looking stuff, it looks kind of like ear mites. Most dogs never get ear mites. It's probably yeast. You can just use Canesten. You can get, over-the-counter clotrimazole for about $5 or $6 compared to $30 for the little ear thing. It's going to last 7 days. You can spend $7 at your pharmacy, and it could last you up to a year. Apply it twice daily for 7 days, and then just use as needed. Spots in dogs. They develop really quickly. You want to catch them early, prevent them from turning into a bigger problem. The sooner you catch them, the easier they are to treat. The principles of treating them: remove the hair around the hot spot, clean with an antiseptic scrub such as chlorhexidine or Arabian green tea. The key to curing them is to get them to dry out. It's a really effective antiseptic solution is tea and aspirin. So you brew up a strong cup of black tea, so about 1/2 cup of water, drop in a regular 325 milligram aspirin. You soak a cloth in this brew and apply it to the area for 5 minutes, 4 times a day. You're just going to wipe that area with the tea and aspirin. Most guys respond really well to it. Stinky dog. We're nearing the end of today's presentation, you guys. So what causes the odor? Most of the dogs with this doggy smell have excessive yeast and bacteria, often secondary to an allergy. First, you want to ideally stop the underlying problem, such as treat the allergy, go back to some of the things we talked about, doing a proper hypoallergenic food trial, trying some of the remedies, allergy remedies, such as high enough doses of essential fatty acids. And then secondary, treat the yeast. And this worked really well. So I made my own little doggy odor shampoo, and so many guys have responded to say how well it's worked. Here's the shampoo recipe: 3/4 cup of water. And I went to my co-op and I got, it's a type of soap. So it's a natural oil-based soap. Say, for instance, big parts of it include olive oil. It's called Castile soap. So but you just use 2 tablespoons of it. You can buy it a 1/2 liter of it concentrated. It's going to last you for years in your house. Then I put in 2 tablespoons of apple cider vinegar, and then 10 drops of lavender oil, which is naturally antifungal and also makes your dog smell well. You lather it up. You want to leave it on for full 10 minutes. So that's me giving Pearl a bath, but you got to time yourself. You got to leave it on for 10 minutes so it really is effective. And rinse your dog really well. I mean, Pearl smelled great for months after, not just a few days. They said of all the shampoos they tried, that was the best one. Now, a little bit about how to lower your veterinary fees. For some common sense thing, just price shop. And these are for procedures, such as maybe a basic checkup, maybe a neutering, for instance. We're not super concerned, but plan on going to at least 3 veterinarians before you decide, and don't ask for discounts. Where the upsell asking question wise. When I talk about this, it's things such as where they might recommend early on your dog needs this dental care or your cat should have this preventive x-ray and or blood work. So just ask a lot of questions. Because often, when they have to justify themselves, they're gonna backtrack. If they really, if you've got an ethical veterinarian, then maybe they're gonna be honest with you. But really ask a lot of questions. Try to decrease how often your dog or cat needs to be in the veterinary clinic. So if there's a procedure, ask it can just be done sort of while you're there, as opposed to keeping them in the hospital overnight. Vaccines, no question, they don't need to be done every year, maybe just twice, and that's it. And the biggest point of all is what you've done to be here on this presentation, becoming an empowered pet owner. More than anything else, where you're aware of some of the common dog and cat diseases, you're aware of some of the holistic options, you're just aware of what are the other options for your dog or cat that don't need to be involved diagnostic testing, don't necessarily mean conventional medication. First, thanks you guys for being on tonight's web clinic. I said an hour and a half, and we've just sort of squeezed in there an hour and a half in 2 minutes. I think like 92 minutes. I really have hoped you've learned a lot. You're going to start using some of the suggestions to help your dog and cat. And now a little bit about my course, Natural Animal Care. 120 lectures, about 20 hours of content, where you're going to learn how to examine your dog and cat at home, learn how to treat your dogs and cats with herbs, homeopathy, acupressure, massage, and nutraceuticals. You're going to be able to determine when it's appropriate to treat your pets at home and when you need to see a veterinarian. You're going to become familiar with the most common veterinary diseases of dogs and cats, along with knowing the most effective natural remedies. You're going to get personal access to me, Dr. Andrew Jones. I'm going to be there guiding you. You're going to have my discussion forum, and you're going to get my personal email. You're going to learn how to naturally treat disease, avoid conventional veterinary medication side effects, develop the skills and confidence to better care for your dogs and cats at home, and you will save on veterinary fees. Then when you complete the course and you pass all the quizzes, there's 120 questions, you can become certified in natural animal care. Don't just take my word for it. This is what Catherine O'Driscoll, founder of the Canine Health Concern, said. Even if you've never heard of Dr. Andrew Jones, I personally believe that the vibration of the planet has been raised by his refusal to live a lie. The problem is that the veterinary profession has been tainted by commerce. Vets are misled by their education, and colleges that rely upon industry funding and governments that act in cahoots with powerful multinationals. What a wonderful world we are in the process of creating. Thank you, Andrew. Thank you, Catherine. Order now and get 3 free bonuses. First, a copy of my book, Veterinary Secrets, Natural Health for Dogs and Cats, a copy of my manual, Pet First Aid, along with my book, Home Recipes for Dogs and Cats. On top of that, Natural Animal Care comes with a 30-day money-back guarantee. Now that we're done the presentation, you can now get Natural Animal Care. We can go to veterinarysecrets.com/course. And thanks, you guys, for sticking through here. And I see you have a few questions there. Someone, Marianne said, asked if I can get a copy of the PowerPoint slides. You bet. You're going to get a copy of the presentation along with the slides. And thanks for being on the presentation, you guys. I hope you've learned a fair amount. I really encourage all of you to have a look at my course, Natural Animal Care. As I said, we've had a number of different pet parents go through it, have been really, really happy with it. They've definitely learned a lot. And I think more than anything, what I'm finding is that I'm teaching a whole variety of things and information, in particular, natural home remedies, herbs, homeopathy, acupressure, massage, some of the variety of supplements. But I find a lot of the pet parents are just reluctant to sort of take action and kind of need that next boost and the next bit of confidence. So I know this course is specifically getting there because that's what I want. I want you to actually use this stuff, not just learn about it, actually implement it in practice because it really can make a difference with the health of your dogs and cats. So thanks for being on here tonight. Thanks, Jamie. Thanks, Carol. Thanks, Ness. Thanks, Marlene. Marlene had a question. Who's having... she's got a 9-year-old pug who's having trouble holding her bowels. Oh, she can't get outside fast enough and falls when she's walking. I'd actually first suggest she gets worked up, because it's one thing having trouble with diarrhea, such as something like inflammatory bowel disease, but if she's also sort of wobbly or ataxic, that sounds neurologic. Thanks, Maureen. Let's see. And thanks all you guys for those positive comments. Super appreciated. So if you have any questions at all around Celeste's fantastic presentation, thanks so much. Thank you. So if you guys have any questions in particular around the presentation, I'm actually going to give you here. I'm going to type in where you can send me an email, because I'm actually going to head off for supper shortly. Let's see. So it'll be Dr. My email. I'm just going to give it to you guys. Dr. Andrew at the online. Dr. Andrew at theonlinevet.com. A whole variety of emails, but this is one I just used for the webinar and just for you guys. So it's Dr. Andrew at theonlinevet.com. Feel free to fire me off an email. So if you have a question around what we talked about tonight, around anything specific relating that your dog or cat may have that I didn't cover with you tonight, any questions about my course, Natural Animal Care, feel free to send me an email. I'd love to respond to you. That's it. Thanks. Well done. Very useful. You're welcome, Matt. Thanks all you guys for being on today's presentation. Well, first, thanks for being here. I'm hoping you found some of it useful and you can implement some of the stuff. And I think the last sort of words in closing is just, if you can just think of sort of 5 things that you could take from the presentation that you may apply. So maybe you might be looking at feeding your dog differently. Maybe you might be looking at feeding your cat differently. Maybe there's 1 or 2 supplements in there I talked about, or 1 or 2 herbs, something for an allergy, something for arthritis that your pet may have or may have had that you could use. And just think of sort of 5 things from that presentation that you could apply, and just try to use those, starting tomorrow or in the top of your head. And maybe make a herbal cream, for instance. A real simple thing to give and to try. And because then you're more likely to follow through with it and sort of implement on a regular basis. So thanks you guys for being on here. And then Michelle says her dog has Cushing's myopathy and ideas for her stiff gaits. Her muscles are very stiff. So Michelle, do you mean Cushing's disease? I guess the question. So she's got hyperadrenal and is she on meds? And you're saying her muscles are very stiff. Ness says I'm a breath of thanks. I'm glad. And you're saying I'm a breath of fresh air. That's awesome. Thanks. Yeah, if you're able to. And Paula said you missed the beginning of the webinar. Any chance of watching it? You bet you're going to get a copy of it, Paula, so you can watch the whole thing. It's all being recorded. And Michelle says myopathy from Cushing's disease. So I assume, Michelle, are you on meds then? Like, are you on Trilostin? And if you're on meds, then likely you've got the high cortisol, and you're not like, is your dog being controlled on medication, or is the cortisol staying up? And it would depend on the type of Cushing's disease. So is it a pituitary tumor, or is it a primary adrenal tumor? Oh, you said no, there's no medication. Okay, so then there's a variety of different things going on. We just know that the adrenal glands are producing too much cortisol, and because of that, you're going to affect how different electrolytes are then absorbed. So that could affect, say, sodium, potassium uptake in the muscles themselves, and causing them to constrict, and then that may lead to things, such as the muscle spasm, or the myopathy, where you've got a muscle degeneration causing stiffness. Regardless, you need to look at some form of treatment. If Michelle, what I'll do is I've actually got the easiest thing for you is to go to my YouTube channel. I'll type it in here and search for Cushing's disease, because I specifically talk about using curcumin for Cushing's disease. And I was just interestingly reading a study where they actually reference using the 95% curcuminoids specifically for Cushing's disease in people as an option to use it as an alternative for some of the conventional meds. So if you're going to treat your dog for it, be the 95% curcuminoids. So you can ideally get those from a natural pharmacy and or even order them on Amazon. You're looking at 100 milligrams per 10 pounds of body weight twice daily. It's obviously not going to work as fast as the conventional meds, but it's worth trying for sort of 6 to 8 weeks. You can give it as a capsule, and you want to make sure you give it with food. Here you guys. So I'm just also, the last thing I'm going to do is just give you guys a link to I'm just going to search out here my YouTube channel. So here, Dr. Jones YouTube. Many of these things you can find on YouTube. I gotta make sure the right Jones. I'm Dr. Andrew Jones. Here it is here. So veterinary secrets. Okay. Okay. So here I'm just here. So I'm just going to leave this for you guys here. Dr. Jones on YouTube. So I do have a YouTube video on Cushing's disease, and specifically then secondary search for curcumin, because I also have a specific video on curcumin, and I reference using curcumin for Cushing's disease. So here's my YouTube channel. Okay. Okay, so there is that. There I am on YouTube. Hope you guys try that out too. Okay, thanks a lot, you guys. I gotta go now because I'm definitely late for supper. But thanks for being on the presentation. I'd love for you to check out Natural Animal Care, and it's at veterinarysecrets.com/course. And once again, if you have any additional questions, just fire me off an email. That's Dr. Andrew at theonlinepet.com. Thanks a lot.